Hi, Aubrey. I'm Andrea. Nice to meet you.
Nice to meet you.
I'm a student at physical therapy at UNLV, and I'm going to be the one doing your treatment today. I hear that you're coming in because you're experiencing some pain and some weakness on that right glute area or your butt area. Is that correct?
Yes.
Okay. I know that you're a performer and that you want to get back to performing without any of those difficulties. So we're going to be working with some exercises that are going to specifically focus on those muscles just to strengthen and kind of get you moving a little bit better. Does that sound good to you?
Sounds good.
During this exercise portion, I am going to maybe at times just help cue you by putting my hands on you and just kind of showing you if there's something I need to correct. I just want to make sure before we move on that that's okay with you.
Yes, that's okay.
Okay, so Aubrey is right now in stage 1 of their healing process. So the first exercise that we're going to teach you is something very simple that you can do at home. Preferably you can do it a couple times a day. This is really to kind of just strengthen and basically get those muscles to fire without putting too much pressure on them. So what I'm going to have you do is go ahead and lie down for me on your back. Perfect. And with this exercise, all I want you to do is you're going to go ahead and squeeze your butt muscles as tight as you can. Perfect. Hold that for 1, 2, 3. Relax. How did that feel?
I feel fine.
Yeah. Could you feel both of your muscles contracting?
Yes.
If you want to make sure that you're really contracting them, what you can do is you can put your hands kind of right here on the side of your butt. Just make sure that you're not putting your hands underneath. There you go. Now go ahead once again. You're going to squeeze as tight as you can. Hold for 5 this time. 1, 2, 3, 4, 5. Release. Does that feel okay?
Yeah.
Okay, let's go ahead and do 10 sets of those. We're going to do 3 sets of them, and for each one, I want you to hold them for 5 seconds long, okay?
Okay.
Perfect. So that would be a stage 1 or a phase 1 exercise. All right. Aubrey's doing really great with therapy, so we're going to progress them to a phase 3 exercise. All right, Aubrey, you've been doing really good with your exercises. I think it's time to move you up to something that's a little bit more challenging. I'm going to have you stand up. I'm going to show you this quick exercise that I want you to do. With this exercise, you're going to go ahead and you're going to lay down on your side. What I want you to do is I want you to focus on having your legs bent like this. You're going to do them on both sides because it's important to balance both glute muscles because they work together for functions like walking. With this exercise, what I want you to do is you're going to grab this ball and you're going to hold it out in front of here. What this is stimulating is that you're keeping your core contracted as you do this exercise because we want that full body coordination. When you go here, what I want you to do is you're just going to lightly lift your leg up and then you're going to extend your leg back like this. And once you're here, you're going to lift it up again and then you're going to bring it back to where you were. Okay. And that's 1. So remember, keep that core tight, extend leg out, up, bring it back down, and we're coming back here.
Okay.
Okay, let's see. You try. Yep. So go ahead, lift, extend, up, back down, and then bring it back to center. Perfect. How did that feel?
Pretty good.
Yeah? Okay. I'm going to stand over here so I can help cue you a little bit. Keep that core nice and contracted. I want you to think about keeping your shoulders and your hips stacked the whole time. So go ahead. Go again. Perfect. So what I want you to do is go ahead and bring your hip up a little bit more so your knees bent a little bit more. Bend your knees a little, bend your hip a little bit more. There you go. Perfect. So now go again. When you lift here, you can extend your leg and now come back as far as you can. So you want to really focus on that glute squeeze, but make sure that you don't arch your back when you do this, okay? So right there. Perfect. Now extend up, come back down, and then bring it forward. That was really great. Let's try that one more time. Extend, squeeze, squeeze, squeeze. Perfect. Come back down, bring it forward. Great job, Aubrey. That was really good. Any questions?
No, I think I'm good.
Okay, we'll do that again for 3 sets of 10.
Okay.
Okay? Or unless it feels like too much, we can keep it at 2 sets. We'll just see how it feels.
Okay.
Awesome. Aubrey's been doing really great with physical therapy. We are going to progress them now to a stage or a phase 4, phase 5 exercise to incorporate more skills that will be useful for them as they go back to performing. Aubrey, you've been doing really great with your exercises. I think it's time to give you a little bit more of a challenge with something that will focus on strengthening and also on the mobility of your lower body sections, specifically your legs and your hip motion.
Okay.
So this next exercise that I'm going to show you is called the skater exercise. With this exercise, we're kind of looking for that power element. So I want quick and fast motions. So what you're going to be doing is you're going to be stepping out and you're going to be reaching your leg as far back as you can, trying to keep that leg from divoting out. You want to keep it as facing forward as possible. And then you're going to just hop right into the next one. So here. So the biggest thing is like keeping your core tight and not letting that foot fall out, right? As you go through those motions. So here, 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 here.
Okay.
Go ahead and give that a try. Good job, that looks pretty good. I think really quick, so go ahead and go back into that position and I want you to jump into one of them. So a few things, your knee is falling out, so try to keep it as straight as you can forward, like that. So really think about engaging those glute muscles and those inner thigh muscles to keep that leg from going out too much. Also, when you hop out, keep this back foot range as far out as you can. The more narrow you are, the less space you have, and so I think that's what makes you want to kind of get your legs out to come out more. So if you widen that, that should keep you more in line with where we want you to be. So try that one more time. There you go. That looks great. Perfect. Okay, I think you're ready for weight. So same principles apply. Keep that core nice and tight. When you jump, when you jump, the leg that you're jumping out with is opposite to the hand that's holding the weight, right? Because then you want to reach down like this. If you have it on the same leg, it's gonna make you kind of go lopsided. So here, and then you're just switching midair.
Okay.
Try that. There you go. Perfect. Good job. How did that feel?
Pretty good.
Nice.
Yeah.
So there and back will be 1 rep.
Okay.
Let's try 10, and then the goal for today will be 3 sets of 10.
Okay.
Any questions?
No.
Awesome.